Hello, my name is Will, and I'll be doing the wound care skill today. Okay, so to start off, I'm going to go ahead and introduce myself to my patient. Hello, my name is Will, and I'll go ahead and be doing some wound care for you today. So could you tell me your name and date of birth? He's going to go ahead and tell me his name and date of birth, and I'm going to go ahead and double check it on his wristband. And yep, everything all checks out. So beforehand, I made sure to check to see what type of wound dressing order procedure he has in, and then I would go ahead and assess his level of comfort. So I'm going to ask him, are you in any pain? And then he'll tell me yes or no, and I will give him his prescribed analgesic. And then after that, I'm going to go ahead and tell him what I'm going to be doing. So I'm just going to go ahead and change out your wound dressing. I'm going to go ahead and make sure it's new and clean. So I'm going to want you to keep your hands to your side, and I don't want you touching anywhere around it or in my sterile field while I'm doing this for you. So then right now I'm going to go ahead and give him some privacy. I'll go ahead, I'm going to go ahead and wash my hands. And then I'm going to go ahead and also grab some gloves. I'll grab the gloves that are back here. We're giving back that privacy. Then I'll go ahead and re-wash my hands. Go ahead and put on my gloves. And then I'll take a look at his abdomen where his wound is at. Okay. Go ahead, expose his abdomen. Right here, I'll go ahead and take off his adhesive. We'll go ahead and toss that out. Other adhesive. Toss that out. Then we'll take off his cover and the 4x4s. We'll toss that out. And then I'm going to go ahead and take the packed gauze out and toss that as well. So then now that I'm here, I'm going to go ahead and note how the wound is looking, and then I'll also note how it smells and see how much and if there's like any type of color associated with the discharge with inside it. So then now that I'm right here, I'm going to go ahead, remove my gloves, toss that out. I'll go ahead and re-wash my hands. And then beforehand, I had already grabbed everything. So I have all my supplies right here. So then I'll get everything all set up for me. So with my sterile field, I'll go ahead and take the flap that's furthest from me, extend that out. I'll go ahead and then take the flap that's to the left, extends that out. I'll take the flap that's to the right, stick that out, and then finally the flap that's right, that goes towards me, and I'll extend that. Then so I'll go ahead and just grab the inch of the corners, turn it a bit just to make it more comfortable. So then now I'm going to go ahead and get everything all situated. So right now I'm going to go ahead and open up my Q-tips from an angle, toss that out, and from an angle, toss that out, going in from an angle, toss that out. Then I'll take my sterile gauze and I'll open it right next, making sure that none of the wrapper touches my sterile field. Then I'll go ahead and take my gauze and do the same. sure none of the wrapper touches my sterile field. Toss that out. Do the same with another piece of 4x4. Make sure I'm coming in from an angle and that none of the wrapper touches the field. So now it's all within the field, so it's an inch away from the corners and everything. I'll go ahead, move it out to the side. Oh, and finally, I'll go ahead and put the top dressing on the side. Usually it would be in the sterile wrapper as well, but just for the class sake, we're going to go ahead and pretend that it was, and we'll go ahead and put that in the sterile field as well. Okay, now that I'm here, I'm going to go ahead and take my prescribed liquid and we shall pour that into the basin. That to the side. I'll go ahead and grab out some adhesive for later. Awesome. And now that we're all finished up with that, I'm going to take my sterile gloves, and then for the sake of just showing it on the video, I'm going to go ahead and do it on his chest. However, I would not be doing that in the field. So I'll go ahead and hand washing. Go ahead and open it up. And taking like the flaps right here, I'll stick my fingers underneath that. Shit. And we'll just pull her open. Alright. And then so with the dominant glove, I'm going to go ahead and grab the cuff on the side that I can touch. Grab that, and I'll stick my hand in. And then with the non-dominant glove, I'll go ahead and grab within the cuff. And then I'm going to go ahead and grab the middle of the paper and just set it to the side. Okay, so then now I'm going to go ahead and take a Q-tip, dip it in the prescribed liquid, and I'm going to go ahead and do a swipe down the middle of the wound. Then we'll go ahead and dispose of that. We'll take a second Q-tip, dip it in this liquid, then we'll go ahead and do a swipe across the wall that's furthest from me. Go and dispose of that. Grab a third Q-tip, do a swipe on the wall that's closest, dispose of that. Fourth Q-tip, wall that's furthest from, or the edge that's furthest from me. Dispose of that. Then a fifth Q-tip. Do the wall that is edge that is closest to me. Dispose of that. So then now we'll go ahead and take our gauze, unravel it a bit, and we'll take the scissors that came within the and cut that out. Get it all. Get it wet, but not too wet. Forceps. Then we'll go ahead and go over to the wound. And as we just drape it down, I'm going to get it in there accordion style. Alright. Go ahead and put that over here. Then we'll go ahead and take our 4x4s, set that on top. So the dry 4x4s go on top of the wet gauze that we packed in there. Take a sterile top one, and then we'll go ahead and place it right on top. So then, when we were taking out the original dressings, I would have made sure, I would have let him know that it could have been painful when taking out the packed gauze, and then pretty much throughout we'll just make sure that he's not in too much pain. So then right now, I'll go ahead and take off my sterile gloves. We'll go ahead and dispose of that. Go ahead and wash my hands. Put on another set of gloves. Take my adhesive that I already set up for myself. Place it on top. And then I'll go ahead, cover back up my patient. Then we're all finished up. So then right now I would have went ahead and told his physician about any bright red discharge as well as possible infection or evisceration. We would have told the physician immediately if I had noticed any of those. Otherwise I'll go ahead and chart how the patient did, any of the other further explanation or education that I did for him, and then I would also have noted or charted how the wound looked, how much discharge was in it, and the color and the smell of it and everything. And with that, that is everything.